Welcome to the Hand and Wrist X-ray course. The hand is anatomically complex with 27 individual bones, and it is prone to injury and trauma, making it important to understand the benefits and limitations of using X-rays to diagnose injury. The aim of this course is for you to become comfortable with an approach to reading hand and wrist X-rays and diagnosing common pathologies seen on these X-rays. The main utility of hand X-rays is in the identification of bony pathology and may be used whenever there is suspicion of bone, ligament, or joint injury, as well as with degenerative processes like arthritis and for identification of foreign objects. We will be focusing mainly on hand pathology in an acute setting, such as with trauma. Before beginning to read an X-ray, it is important to ensure that the X-ray is of adequate quality. You should ensure that all the bones are visible, that there is no motion artifact, good exposure, and that the correct hand was used. These images show how over and under exposure can affect a radiograph, as well as motion artifact on X-ray. Although this is an image of a spine, you can see that motion caused it to have this blurry appearance. In addition, it is important to order multiple views with the standard hand X-ray series, which includes the posterior anterior, oblique, and lateral views. The posterior anterior, or more commonly known as PA view, is great to see the fingers in anatomic position. The patient has an X-ray taken with their hand resting on the table, palm down, as seen in this photo. This is used instead of the anterior posterior, which would be palm up, because it naturally encourages straightening of the fingers. There are certain situations in which you would use an AP view instead, often with bent fingers called the ball catcher's view, which can reveal changes indicative of pathologies like rheumatoid arthritis. The oblique view is used to see a variety of conditions, including arthritis, fractures, dislocations, and foreign bodies. It involves raising the radial aspect of the hand from the PA position. Finally, the lateral position is 90 degrees from the PA view and can help determine fracture displacement, which may not be obvious from one view alone. To illustrate this idea, here's an example of a left index finger dislocation. From the PA view alone, you wouldn't necessarily see that there's a dislocation, but by getting additional views, the oblique and lateral views, you can see that there is a significant dislocation at that joint. If you are concerned about only a single finger, you can also get a dedicated finger view. If you are suspecting a thumb injury specifically, it can also be helpful specifically to get an AP thumb view, with the positioning shown here. Because the thumb rests in a different plane than the other fingers, when you order an AP view of the other fingers, it is not a true AP view of the thumb, so that is why ordering an AP thumb specifically can be helpful. A final note about views. Ordering bilateral hand X-rays, like the normal ones shown here, may be helpful in some circumstances because you can compare it to an uninjured mirror image. Bilateral hand X-rays are more commonly done in the setting of arthritis, but can be used when needed in a trauma setting, and it's a good tool to have in your back pocket if you're ever unsure about a diagnosis. While X-rays are best for diagnosing bony pathology, there may be clues on X-ray that can indicate soft tissue injury. Normally, you should see a soft tissue contour that is mostly uniform, except in areas that may have skin folds, such as in the thenar area here. This is an example of a normal hand X-ray. In settings of hand injury, you may sometimes see clues of soft tissue involvement, such as with swelling, discontinuity, or collections. Here's an example that shows a severely swollen dorsal contour. In this case, you can tell that there has been an injury, and you might be worried about compartment syndrome in the context of this much swelling. This image shows discontinuity of the thumb due to a partial amputation. So just by looking at this X-ray, you already know that this is an open fracture. A final example of soft tissue clues seen on X-rays, you can see here that there is subcutaneous emphysema or gas bubbles in the hand that tracks up the forearm. This is likely caused by necrotizing fasciitis, which is a life-threatening infection and medical emergency. Whether or not there is a soft tissue injury, it is always important to correlate hand X-rays to history and clinical exam. Knowing about the mechanism of injury and past hand injuries is crucial for properly evaluating hand trauma. For example, saw-related injuries tend to often be much worse than they may appear on initial exam, compared to a similar injury with a sharp knife. Other hand-specific considerations to ask about during clinical exam include occupation, smoking status, and hand dominance. Occupation and hand dominance are important in gauging functional requirements, while smoking impairs wound healing significantly. In an identical injury, the management may differ if it is the dominant hand of a non-smoker who requires fine motor skills at work, for example, this pianist, compared to the management of a 98-year-old in a long-term care home who smokes a pack of cigarettes a day. As a result, it is important to take any diagnosis in context.